Imagine a world where silence is never truly silent, a world where, even in the most tranquil moments, a persistent sound lingers in the background, a world where a constant ringing, buzzing, or hissing accompanies you, even in the quietest of rooms. This uninvited noise can vary in pitch and intensity, sometimes resembling a high-pitched whistle, at other times a low, droning hum. This is the reality for millions of people living with tinnitus, a condition characterized by the perception of sound without an external source. It can affect anyone, regardless of age, gender, or background, making it a universal challenge. Tinnitus is surprisingly common, affecting roughly 15% of the population to some degree. This means that out of every 100 people, about 15 are dealing with this persistent auditory phenomenon. While often perceived as a minor annoyance, for some, it can be a debilitating condition, impacting sleep, concentration, and overall quality of life. Imagine trying to fall asleep with a constant ringing in your ears, or attempting to focus on work while a persistent buzz distracts you. Understanding the causes of tinnitus is crucial for both prevention and effective management. It can stem from a variety of sources, including exposure to loud noises, ear infections, or even certain medications. This exploration delves into the science behind this often misunderstood condition, shedding light on its varied origins and the hope that exists for those who live with its constant hum. Researchers are continually seeking new ways to alleviate the symptoms and improve the lives of those affected. Let us embark on a journey into the world of sound and silence, exploring the intricate workings of the auditory system and the factors that can disrupt its delicate balance, giving rise to the phantom symphony of tinnitus. We will look at the latest advancements in treatment, from sound therapy to innovative medical interventions, and hear from those who have found ways to cope and thrive despite the challenges. Many people find relief through various coping strategies. White noise machines, for instance, can help mask the internal sounds, providing a semblance of peace. Mindfulness and meditation practices can also be beneficial, helping individuals manage the stress and anxiety that often accompany tinnitus. Support groups and therapy sessions offer a platform for those affected to share their experiences and coping mechanisms, fostering a sense of community and understanding. Knowing that you are not alone in this struggle can be incredibly empowering. Ultimately, while tinnitus can be a challenging condition, it is possible to lead a fulfilling life. By understanding the condition, seeking appropriate treatment, and adopting effective coping strategies, individuals can reclaim their sense of peace and well-being. Join us as we delve deeper into the world of tinnitus, uncovering the mysteries of this condition and exploring the paths to relief and resilience. Together, we can navigate the journey from noise to tranquility, finding hope and harmony along the way. One of the most common culprits behind tinnitus is prolonged exposure to loud noises. This can range from the roar of heavy machinery in industrial settings to the amplified music at concerts and clubs. Even seemingly innocuous sounds, like the constant hum of traffic or the blast of a car horn, can, over time, damage the delicate hair cells within the inner ear. These hair cells are responsible for converting sound waves into electrical signals that are then transmitted to the brain, where they are interpreted as sound. When exposed to excessive noise, these delicate structures can become damaged or even destroyed, leading to noise-induced hearing loss. Tinnitus often emerges as a consequence of this damage. As the brain struggles to make sense of the altered signals coming from the damaged inner ear, it can misinterpret these signals as phantom sounds, leading to the perception of ringing, buzzing, or hissing, even in the absence of any external noise. The experience of tinnitus can vary greatly from person to person. Some individuals describe it as a high-pitched ringing, while others experience it as a low-frequency hum, buzzing, clicking, or even a pulsing sensation that seems to coincide with their heartbeat. This variability reflects the complex nature of tinnitus and the fact that it is not a single condition, but rather a symptom with a multitude of potential underlying causes. In some cases, tinnitus may be temporary, subsiding once the underlying cause, such as an ear infection or exposure to loud noise, is resolved. However, for many, tinnitus becomes a chronic condition, a constant companion that can significantly impact their daily lives. The phantom noises can interfere with sleep, making it difficult to fall asleep or stay asleep. It can also make it challenging to concentrate, especially in quiet environments where the tinnitus becomes more noticeable. Section 4. The aging ear, presbycusis, and its link to tinnitus. As we age, so too do our ears. The process of aging affects every part of our body, and our ears are no exception. Over time, the structures within our ears undergo changes that can impact our hearing ability. Just like other parts of our body, the delicate structures within the inner ear are susceptible to wear and tear over time. The inner ear contains tiny hair cells that play a crucial role in our ability to hear. These hair cells can become damaged or die as we age, leading to hearing loss. This age-related hearing loss, known as presbycusis, is a common condition, particularly among older adults. It is estimated that 1 in 3 people in the United States, between the ages of 65 and 74, has hearing loss, and nearly half of those older than 75 have difficulty hearing. Presbycusis typically affects both ears and gradually progresses over time. It is a bilateral condition, meaning it affects both ears equally. This gradual progression can make it difficult for individuals to notice the changes in their hearing until it becomes more pronounced. It often begins with difficulty hearing high-pitched sounds, such as women's and children's voices, or the consonant sounds in speech. These high-frequency sounds are often the first to be affected because the hair cells responsible for detecting them are more vulnerable to damage. As the condition progresses, it can affect the ability to hear lower-pitched sounds as well. This can make it challenging to follow conversations, especially in noisy environments, and can lead to social isolation and frustration. The exact link between presbycusis and tinnitus is not fully understood, but it is thought that the damage to the hair cells within the inner ear, which is a hallmark of age-related hearing loss, may also play a role in the development of tinnitus. Tinnitus is the perception of noise or ringing in the ears, and it can be a distressing condition for those who experience it. As the hair cells deteriorate, they may send erratic signals to the brain, which can be misinterpreted as phantom sounds. These phantom sounds, or tinnitus, can vary in pitch and intensity and may be constant or intermittent. While there is no cure for tinnitus, there are treatments and strategies that can help manage the symptoms and improve the quality of life for those affected. Managing presbycusis and tinnitus often involves a combination of hearing aids, sound therapy, and counseling. Hearing aids can amplify sounds and make it easier to hear, while sound therapy can help mask the tinnitus sounds. Counseling and support groups can provide emotional support and coping strategies for dealing with hearing loss and tinnitus. Regular hearing checkups are important for early detection and management of presbycusis and tinnitus. If you or a loved one is experiencing hearing loss or tinnitus, it is important to seek professional help. Early intervention can make a significant difference in managing these conditions and maintaining a good quality of life. Section 5. Beyond the ears. Tinnitus and underlying medical conditions. Tinnitus, often described as a ringing, buzzing, or hissing sound in the ears, can be a perplexing and distressing condition. While it is commonly associated with issues directly related to the ears, such as exposure to loud noises or age-related hearing loss, the reality is that tinnitus can be a symptom of a much broader range of underlying medical conditions. While exposure to loud noise and age-related hearing loss are among the most common causes of tinnitus, it is important to remember that tinnitus is a symptom, not a disease in itself. This means that it can be triggered by a variety of factors, some of which may not be immediately obvious. For instance, prolonged exposure to loud environments, such as concerts or industrial workplaces, can damage the delicate structures within the ear, leading to tinnitus. Similarly, the natural aging process can result in the gradual deterioration of hearing, which may also manifest as tinnitus. As such, it can be triggered by a wide range of underlying medical conditions, some of which may not be immediately obvious. These conditions can range from relatively benign issues to more serious health concerns. For example, certain medications are known to have tinnitus as a potential side effect. This includes commonly used drugs such as aspirin, some antibiotics, and certain antidepressants. It is crucial for patients to be aware of these potential side effects and to discuss any concerns with their healthcare provider. For example, tinnitus can be a side effect of certain medications such as aspirin, some antibiotics, and some antidepressants. These medications can affect the auditory system in various ways, leading to the perception of tinnitus. Patients should always inform their doctors about any new or worsening symptoms they experience while taking medication, as adjustments to the treatment plan may be necessary. It can also be a symptom of conditions that affect blood flow to the head and neck, such as high blood pressure, atherosclerosis, and other cardiovascular issues. When blood flow is compromised, it can lead to changes in the auditory system that result in tinnitus. Managing these underlying conditions through lifestyle changes, medication, or other treatments can sometimes alleviate the symptoms of tinnitus, and head or neck injuries. Trauma to these areas can disrupt the normal functioning of the auditory system, leading to tinnitus. This is why it is important for individuals who have experienced such injuries to seek medical evaluation and treatment to address any potential complications, including tinnitus. In some cases, tinnitus may be a sign of a more serious underlying condition, such as a tumor on the auditory nerve, acoustic neuroma, or other neurological disorders. These conditions require prompt medical attention and intervention to prevent further complications. Diagnostic imaging, such as MRI or CT scans, can help identify these issues and guide appropriate treatment. Or Meniere's disease, a disorder of the inner ear that can cause vertigo, hearing loss, and tinnitus. Meniere's disease is a chronic condition that can significantly impact a person's quality of life. Managing this condition often involves a combination of dietary changes, medication, and sometimes surgical interventions to control symptoms and improve overall well-being. It is therefore essential to seek professional medical advice if you experience tinnitus, especially if it is persistent, severe, or accompanied by other symptoms such as dizziness, hearing loss, or pain in the ear or head. An ENT specialist can conduct a thorough evaluation to determine the underlying cause of tinnitus and recommend appropriate treatment options. Early intervention can help prevent the condition from worsening and improve the chances of successful management, or pain in the ear or head. Remember, tinnitus is not just an isolated issue, but can be a sign of broader health concerns. By addressing the root cause, whether it be medication side effects, cardiovascular issues, or other medical conditions, individuals can find relief from tinnitus and improve their overall health. Always consult with a healthcare professional to explore the best course of action for your specific situation.